In the name of Allah, who is most merciful and beneficent. Assalamu alaikum. I am Rukma Shahid, student of BS Physics, Batch 11 at the University of Management and Technology. And in this video, I am going to talk about styrofoam, and I have submitted this assignment to Dr. Hammad Majeed. First of all, in this video, I describe the history of styrofoam. Styrofoam was first synthesized in 1972 by Squist Bogus, and his research group was pharmaceutical company Landbeck and was first marketed in 1989 in Denmark. It was first marketed in the US in 1998. Definition: it was an antidepressant belonging to the class of selective serotonin reuptake inhibitors widely used to treat the symptoms of depression. It is a racemic bicyclic fatty derivative and is the only compound with the tertiary amine and two nitrogen containing metabolite amides, all SSRIs. This is the structure of styrofoam. Then major depressive disorders MDD. Common mental illness. Number two, it is associated with morbidity, poor quality of life, and a high risk of suicide. Serious impacts on patient and their families. Symptoms. Two main symptoms associated with MDD. Number one, anhedonia, inability to experience from various activities, e.g., exercise and hobbies. Number two, reduced motivation related to reduced activity of our mesolimbic dopamine system. Because of this, it is believed that the antidepressant drug should increase should increase the release of neurotransmitters serotonin, dopamine, and even that of epinephrine. Styrofoam and MDD. Number one, styrofoam worked by inactivating serotonin transporters. Number two, these prevent presynaptic reuptake and increase the synaptic extracellular concentration of serotonin. Number three, increase in stimulation of all serotonin receptors and e.g. postsynaptic 5-HT receptors. Limitation of styrofoam. Number one, there is a delayed onset of action with these antidepressant drugs, and this can cause an increased duration of time that the impairments associated with MDD can occur. One of these impairments is an increased risk of suicide. Number two, the antidepressant also have a delayed onset of action and usually take 4 to 6 weeks to take full effect. The delayed onset of action of styrofoam is believed to be due to this reduced 5-HT receptor stimulation pharmacodynamic properties. Styrofoam is a potent in vitro inhibitor of serotonin 5-HT uptake. Its activity in this respect is more than 3,000 times greater than that against noradrenaline uptake, making it the most serotonin selective agent in its class. Styrofoam has low affinity in vitro for adrenergic, muscarinic, dopaminergic, and serotonergic receptors. Evidence from behavior studies in animal sports, a selective facility effect of styrofoam on serotonin neurotransmitters. Styrofoam is a weaker in vitro and in vivo inhibitor of the hepatic cytochrome P45 CYP2D6 isozyme than prozactin and fluoxetine, and therefore has a lower potential for pharmacokinetic interaction with cytochrome CYP2D6 substrate with such as tricyclic antidepressant and antipsychotic agent. Pharmacokinetic properties. Absorption and distribution. The absorption of styrofoam is not affected by food, and its oral bioavailability is reported to be approximately 80%. Peak plasma level occur 2 to 4 hours after single or multiple doses, and the mean peak plasma concentration following doses of 40 mg per day at steady state is 311 nmol over L power 21. Styrofoam is 80% protein bound, somewhat less than other SSRIs. Therefore, it is less likely to be involved in drug interaction that occur secondary to drug displacement from protein binding. It is widely distributed among peripheral tissue with a volume of distribution estimated to be between 12 and 16 L over kg. At clinical relevant doses, styrofoam displays linear pharmacokinetic power 24. There is a linear correlation between doses and steady state concentration of styrofoam and its metabolisms. However, no clear correlation has been established between plasma concentration and clinical response. Inter-individual variation in plasma level is about sevenfold and appears to be independent of sex or age up to age 65. Intra-individual variability is estimated at 50%. Steady-state plasma level are reached within 1 to 2 weeks at each dose level. Metabolism Styrofoam is metabolized in the liver by 2N dimethylation step to D-methylstyrofoam DCT via CYP2C19 and 3A4 and to di-dimethylstyrofoam DDCT via CYP2D6. Oxidation occurs by minor amine oxidases A and B and aldehyde oxidase to form a propionic acid derivative and styrofoam and oxide. At single doses as well as steady state plasma concentration, the amount of metabolized in reaction to the parent drug styrofoam are 30% to 50% for DCT and 5% to 10% for DDCT. In vitro studies suggest that styrofoam is at least 4 times more potent than DCT and 30 times more potent than DDCT in inhibiting the reuptake of 5-HT. Since these metabolites enter the brain less readily and are present in lower concentrations, they do not appear to play a major role in the clinical action of styrofoam. The N-oxide and propionic acid derivatives are present in lower concentration in plasma. The impact of metabolizer state, poor or extensive, on styrofoam metabolism is considered to be clinically insignificant. Toxicity: Styrofoam was administered orally to pregnant rats during late gestation and lactation periods at doses to 4.8, 12.8, and 32 mg kg or day, which are approximately 1, 3, and 8 times the MRHD at 40 mg basis on mg or meter square body surface area. Styrofoam increase of spring motility during the first 4 days of birth and decrease of spring growth at 32 mg kg days, which is approximately 8 times the MRHD. In separate studies, similar effect on offspring motility and growth were seen when dams were treated throughout gestation and early lactation at doses 24 mg kg days, which is approximately 6 times MRHD. In NOAEL was not determined in that study. RIS, including styrofoam, has been associated with cases of clinically significant hyponatremia in elderly patients who may be greater risk for this adverse reaction. The following has reported with styrofoam tablet overdoses, seizures, which may be delayed, and altered mental status, including coma. 19. Cardiovascular toxicity, which may be delayed, including QRS and QTC, interval prolongation, wide complex decademize and torsades points. Hypertension is most commonly seen, but hypertension can really be seen along or with co-ingestant, including alcohol. 19. Serotonin syndrome, patient with a multiple drug overdosage with other pro-serotonergic drugs may have higher risk. Styrofoam increase the incidence of small intestine carcinoma in rats treated for 24 months at doses of 8 and 24 mg kg and days in the diet, which are approximately 2 and 6 times the maximum recommended human doses MRHD of 40 mg, respectively based on mg over or m meter square body surface area. A, a no effect level for this finding was not established. Teleform did not increase the incidence of tumors in mice treated for 18 months at doses up to 240 mg kg days in the diet, which is approximately 30 times the MRDH of 40 mg based on mg or meter square body surface area. Styrofoam was administered only to female and male rats at doses of 32, 48, and 72 mg kg day prior to and throughout mating and continuing to gestation. These doses are approximately 8, 12, and 17 times the MRHD of 40 mg based on mg or meter square body surface area. Mating and fertility were decreased at doses 32 mg kg day, which is approximately 8 times the MRHD. Gestation duration was increased to mg kg or days, which is approximately 12 times the MRHD 19. How to use Teleform HBR. Take this medication with or without food as directed by your doctor, usually once daily in the morning or evening. This dosage is based on your medical condition, response to treatment, lab test, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drug, non-prescription drug, and herbal products. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device spoon. Do not use a household spoon because you may not get the correct dose. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some condition may become worse than this drug is suddenly stopped. Also, you may experience symptoms such as mood swings, headaches, tiredness, sleep changes, and brief feelings similar to electrical shocks. It may take 1 to 4 weeks to feel a benefit from this drug and up to several weeks before you get the full benefit. Tell your doctor if your condition does not improve or it is worsen. Side effect: no nausea, nausea, dry mouth, loss of appetite, drowsiness, sweating, blurred vision, or yawning may occur. If any of these affect last or get worse, tell your doctor or pharmacist promptly. Remember this that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effect. Many people using this medication do not have serious side effect. Tell your doctor right away if you have any serious side effect, including shaking, decreased interest in sex, change in sexual ability, easy bleeding. Get medical help right away if you have very serious side effect, including fainting, fast irregular heartbeat, black stools, vomit that look like coffee grounds, sneezes, eye pain, swallowing, redness, wind, widened pupils, vision changing, such as seeing rainbow around light at night. This medication may increase serotonin and delay cause a very serious condition called serotonin syndrome toxicity. The risk increase if you are also taking other drugs that increases serotonin. So tell your doctor or pharmacist of all the drugs you take. Get medical help right away. Get Get medical help right away if you develop some of the following symptoms: fast heartbeat, hallucination, loss of coordination, severe dizziness, severe nausea, vomiting, diarrhea, twitching muscles, unexplained fever, unusual agitation, restlessness. Males have painful or prolonged aeration lasting 4 or more hours. If this occurs, stop using this drug and get medical help right away, or permanent problem could occur. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of the serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. Precautions before number one. Before taking Stelliform, tell your doctor or pharmacist your medical history, especially of personal or family history of bipolar, manic depressive disorder, personal or family history of suicide attempts, liver diseases, nasal lower sodium in the blood, bleeding problems, personal or family history of glaucoma. Number two, stelliform may occur a condition that affect the heart rhythm. QT prolongation. QT prolongation can really cause serious, fast, irregular heartbeat and other symptoms such as severe dizziness, fainting that need medical attention right away. Number three, the risk of QT prolongation may be increased if you have certain medical condition or are taking other drugs that may cause QT prolongation. Before using stelliform, tell your doctor or pharmacist all the drugs you take, and if you have any of the following conditions: certain heart problems, heart failure, slow heartbeat conditions, certain heartbeat problems, recent heart attack, QT prolongation in the EKG, family history of certain heart problems, QT prolongation in the EKG, sudden cardiac death. Number four, children may be more sensitive to the side effect of this drug, especially to the loss of appetite and weight loss. Monitor weight and height in the children who are taking this drug. Number five, during pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Also, babies born to mother who have used this drug during the last 3 months of pregnancy may really develop withdrawal symptoms such as feeling, breathing difficulties, sneezer, muscle stiffness, or constant crying. If you notice any of these symptoms in your newborn, tell the doctors prominently. Number six, this drug passes into breast milk and may have undesirable effect using a nursing infant. Consult your doctor before breastfeeding interactions. Number one, during interaction may change how your medication work or increase your risk for self side effect. Number two, some product that may interact with this drug or other drugs that cause bleeding, bruising, appetite, drugs such as clopidogrel and NSAID such as naproxen, blood thinner such as varfarin. Number three, check the labels on all your medicines such as allergy or cough and cold products because they may contain ingredients that cause drowsiness. Ask your pharmacist before using those products safely. Number four, many drugs besides Stelliform may affect the heart rhythm, QT prolongation, among others. Stelliform is very similar to S. Stelliform. Do not use medication containing S. Stelliform while using Stelliform. Number six, this medication may interfere with certain medical lab tests, possibly causing false test result. Make sure lab person and all your doctor know you use this drug. Overdoses. If someone has overdoses and his serious symptoms such as passing out or trouble breathing, call 911. Otherwise call a poison control center right away. Brain notes: do not share this medication with others. Lab and medical tests such as EKG should be done while you are taking this medication. Keep all medical and lab appointments. Consult your doctor for more detail. Medical doses. If you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next day at a regular time. Do not double the dose to catch up. Storage. Store at room temperature away from light and moisture. Do not store the bathroom. Keep medication away from the children and pet. Do not flush medication down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company. Then images of different grams of styrofoam. First styrofoam 20 gram. This medication is a pink round square film coated tablet imprinted with Ig and 207. Styrofoam 40 gram. This medicine is a tan oval scroll film coated tablet imprinted with 40 and 1011. Styrofoam 10 gram. This medicine is a beige round film coated tablet imprinted with Ig and 206. Conclusion. To the editor in their article, Eric Gillen's MD Title 1, after noting three limitations of their trial, its small size problems with random assignment and diagnostic heterogeneity in their study groups, reported positive summary statement in their conclusion and elsewhere. For example, they wrote, notwithstanding these limitations, the study suggests that as in younger people, SSRIs are efficacious and well tolerated in the treatment of anxiety disorders in elderly persons. The author's statement regarding the efficiency tolerability of styrofoam in geriatric anxiety disorder may be true, but their published repeated positive conclusions are not consistent with their evidence. For example, the results section demonstrated that 11 members of a treatment group of 17 subjects experienced less anxiety than a placebo group. However, 88% of the treatment group were women and 40% received various doses of lorazepam while they received various doses of styrofoam according to their clinical response. This treatment group was compared to an unmatched placebo group, 65% of whom were males and only 24% of whom were administered of various doses of lorazepam. Thank you so much.